When it comes to shoulder complaints, I'm very curious if the root cause is a mechanical problem in the shoulder joint or a mechanical problem in a joint in the spine. And yes, there are other diagnoses like tendinopathies and structural lesions and even degeneration, but I think that those are way overdiagnosed because in my clinic, I find that most people can resolve their shoulder complaints with 1 to 2 simple movements done repeatedly, either in the spine or in the shoulder. When it comes to repeated movement testing of the shoulder, I often test the repeated movement of shoulder extension. Other common tests I will use are repeated shoulder internal rotation behind the back or repeated shoulder horizontal adduction. But when it comes to shoulder extension, there's 2 main ways we can do it. There are others, but there are 2 primary ones. One is having the patient hold a golf club or something long and pushing with the stick, the shoulder back into full extension. More commonly, I'll have the patient place his or her hand on a surface. This chair is a little bit low, but we can use this chair. You could also use a bookshelf or a kitchen counter or something a little bit higher so the patient doesn't have to lunge or squat quite as low and put as much effort through their lower extremities. But to demonstrate, I'll show you that you can put the hand here, and I'm typically using it extension of the shoulder with internal rotation, although you can also vary the amount of rotation, putting the hand in neutral, for example, or external rotation. But typically I find that patients who have a joint problem in the shoulder and need shoulder extension need the version of shoulder extension with this shoulder internally rotated, which places the palm up. So for this, I'm having the patient place their hand on something that's comfortable. If it's too hard, like a piece of wood, they can put a towel down, placing the shoulder palm up, and then staggering their feet and lunging down until they feel that strain. You know you've gotten to end range of a movement when you feel that strain around the joint and you feel like you can't go any further. So when I do repeated movement testing, that means I take the patient's complaints, the shoulder baselines in terms of symptoms, mobility, strength, and then a functional test like if a push-up hurts or if reaching into the back pocket hurts. Then I apply repeated movement in one direction. So if I choose to test shoulder extension, I'll have the patient do some of these. I might start with less pressure and doing it myself first or with the golf club variety, and then maybe advance to more pressure by putting the patient's hand on this and having them dip down. But I'm typically getting to this form of shoulder extension for most patients. But again, it's cause and effect. We will do the repeated movement. We'll do 10 or so shoulder extensions to end range and then retest the baselines. And by adding repeated movement testing to my orthopedic evaluation, I find well over half of patients can fix their shoulder problem with either 1 to 2 simple movements of the shoulder or 1 to 2 simple movements of the spine.